Good morning, everyone. My name is Dr. Anjali, and today I'll be presenting on a high-yield topic for NEET PG, gastrointestinal hormones. So this topic is clinically important and frequently asked in exams. I'll simplify the concepts, give you mnemonics, and help you link it to clinical scenarios. So let's get started. Now, the first slide is about overview of GIT hormones. All right. So to begin, GIT hormones will regulate digestion, it regulates absorption and motility in the gastrointestinal tract. So what does it do? It regulates digestion, absorption and motility in gastrointestinal tract. So here's an easy mnemonic to remember all the major GIT hormones. So what is a mnemonic? It says go secretly, cook very good meals, where G here stands for gastrin, S stands for secretin, C for cholecystokinin, CCK, V for vasoactive intestinal peptide, VIP, G for gastric inhibitory peptide or GIP, and meals, M. M will stand for mutilin. Okay, so what is a mnemonic? The mnemonic is go secretly, cook very good meals. Gastrin, secretin, cholecystokinin, vasoactive intestinal peptide, gastric inhibitory peptide, M, which stands for mutilin. All right. So now we'll go through each hormone one by one, their source, stimulus, actions, and clinical relevance. So this breakdown will make it very easy to remember. All right. Now moving on to the first one, gastrin. Okay. So we'll start with gastrin. So gastrin is secreted by G cells in the antrum of stomach. So what is the source? Gastrin. The source is G cells in the antrum of stomach. Gastrin is secreted by G cells in the antrum of stomach. Now what is the stimulus? So it is released when stomach stretches after a meal. So it is released when stomach stretches after a meal, when the vagus nerve is activated. All right. So stomach stretches. Next, what happens is vagus nerve gets activated. All right. Or when peptides or protein digestion products are present. Okay. So when is it stimulated? It is stimulated when stomach is stretched after a meal, when the vagus nerve is activated, or when peptides are present. By peptides, I mean protein digestion products are present. Okay, now what are the actions? So gastrin has three main actions. Okay, now what is the first one? So it increases gastric acid, HCl, secretion. All right, so what are the actions? The first action will be it increases gastric acid secretion. Gastric acid is HCl. All right, so this is crucial for protein digestion. So this is for protein digestion. So this is very crucial for protein digestion. So that is the first action. So first action is it increasing gastric acid secretion. That is HCl secretion is increased. Okay, so this is crucial for protein digestion. Now the second point, the second action will be gastric motility. So it increases gastric motility to mix and churn food. So this is important to mix and churn food. Okay, gastric motility is increased to mix and churn food. All right. Now, second point is done. The third action will be to promote the growth of gastric mucosa. Okay, that is to protect the stomach lining. All right. So, what is the third point? To increase the growth of gastric mucosa, to promote the growth of gastric mucosa, to protect the. This is to protect stomach lining. All right. Now, what is a clinical correlation or clinical link? So here, excessive gastrin production will occur in Zollinger-Ellison syndrome. Okay, so this is due to gastronoma. So excessive gastrin production will occur in Zollinger-Ellison syndrome due to a gastronoma. So this can lead to very high acid secretion and recurrent peptic ulcers. So what does this lead to? This can lead to very high acid secretion and recurrent peptic ulcers. All right. So if you see a question with recurrent ulcers and elevated gastrin, you will have to think about Zollinger-Ellison syndrome. Okay. So if you see a question with recurrent ulcers and elevated gastrin, think of Zollinger-Ellison syndrome. So I hope all of you are clear with gastrin. Now moving on to cholecystokinin. The next slide. Okay. Yeah. So cholecystokinin, the next one. So cholecystokinin is also called CCK. Now what is the source? So CCK is secreted by eye cells. Okay, it is secreted by eye cells in the duodenum and jejunum. So what is the source? Eye cells in duodenum and jejunum. Okay, now the stimulus. CCK is released when fatty acids and amino acids enter the duodenum after a fatty meal. So what is the stimulus? It is released when fatty acids and amino acids enter the duodenum after a fatty meal. Okay, so released when fatty acids and amino acids enter the duodenum. It enters duodenum after fatty meal. All right. Now, what are the actions? So again, these have three actions. So you'll have to remember CCK, which has three key actions. So what is it? So it contracts the first action. The first action is it contracts the gallbladder to release bile, which is needed to digest the fats. Okay. The first action is gallbladder contraction to release bile. Contracts the gallbladder to release bile. So this is needed to digest fats. So this is to digest fats. Okay. Now, so that is about the first action. Now, what is the second action? The second action is increasing pancreatic enzyme secretion. So it stimulates the pancreas to secrete digestive enzymes like lipase, amylase, and proteases. So the pancreas is stimulated to secrete digestive enzymes like lipase, amylase, and protease. Okay, so that is about the second action. Now the third action will be decreasing gastric emptying. So it slows gastric emptying, okay, allowing fats to be properly digested. So what happens? The third action is slowing down gastric emptying. Okay, so this will allow fats to be properly digested. Okay, now we're done with all the three actions. Now, cholecystokinin, what is the source? Eye cells in duodenum and jejunum. And the stimulus is presence of fatty acids and amino acids. So now what are the three actions? The first action is gallbladder contraction to release bile. So that will help in digesting fats. The second action will be increasing pancreatic enzyme secretion. Okay, so what to secrete? Digestive enzymes. Okay, what are the digestive enzymes? Lipase, amylase, and proteases. Now the third one is gastric emptying. So slowing down gastric emptying, isn't it? So that is to be properly, that is for fats to be properly digested. All right. Now we have a mnemonic here. So what does it say? CCK. Chews, contracts, keeps full. Okay. So think of CCK as chews, contracts, and keep full, where chews stands for enzymes for digestion. Chews is enzymes for digestion. Contracts will stand for gallbladder contraction, and keeps full. Keeps full is delays gastric emptying. So just think about CCK as chews, contracts, and keeps full. So chews will stand for enzymes for digestion, contracts for gallbladder contraction, and keeps full is for delayed gastric emptying. Okay, so this is for enzymes for digestion. So what are the enzymes for digestion? Again, lipase, amylase, and protease. All right. Now, so that is about cholecystokinin. Now moving on to the next one. So that will be secretin. The next enzyme is secretin. All right. Now, what is the source of secretin? So secretin is released by S cells in duodenum. Secretin is released by S cells in the duodenum. All right. Now, what is the stimulus? So it is released, or its release is triggered by acid chyme entering the duodenum from the stomach. Okay. So what is it triggered by? It is triggered by acid chyme entering the duodenum from the stomach. It enters from stomach. Okay. Now, what is the source of secretin? S cells in duodenum. And what is the stimulus? Triggered by, release is triggered by acid chyme entering the duodenum from the stomach. All right. So now we're done with source and stimulus of secretin. Now moving on to the actions. So secretin has 3 key actions, right? Now let's see one by one. Okay. Now the first action is stimulating bicarbonate secretion from pancreas. So it stimulates the pancreas to secrete bicarbonate-rich fluid. So pancreas is stimulated to secrete bicarbonate-rich fluid. So this neutralizes the acid and protects the duodenal mucosa. So what does this do? This helps in neutralizing the acid. First, neutralizes the acid and protects duodenal mucosa. All right. Now, the second one is gastric acid secretion, inhibiting gastric acid secretion. All right. So why does it inhibit gastric acid secretion? So this will reduce acid overload. To reduce acid overload. Okay. Inhibiting gastric acid secretion will reduce acid overload. All right. Now, the third action, that is increasing bile secretion or stimulating bile secretion. Okay. So it will help you stimulate the bile secretion, which aids in digestion. To aid digestion. So now what is about secretin? What are the key actions? There are 3 key actions. The first one is stimulating bicarbonate secretion from pancreas, okay, which helps in neutralizing the acid and protecting the duodenal mucosa. The second one is inhibiting gastric acid secretion to release acid overload. All right. The third one will be stimulating bile secretion to aid digestion. Okay. Now what is the clinical use? The secretin stimulation test is used to assess pancreatic function, especially in suspected pancreatic disorders. Okay, so the secretin stimulation test is used to assess pancreatic function. SST, secretin stimulation test, is used to assess pancreatic function, especially in patients with suspected pancreatic disorders. Okay, so that is about the clinical use. Now, the next slide. The next slide will be gastric inhibitory peptide or GIP. Okay, so what is the source? GIP is secreted by K cells in the duodenum and jejunum. Okay, so gastric inhibitory peptides is secreted by K cells in duodenum and jejunum. Let me turn the page. Yes. Now, what is a stimulus? So GIP is usually released in response to glucose, fatty acids, and amino acids. in the small intestine. So what is the stimulus? It is released in response to glucose, fatty acids, and amino acids in small intestine. Okay? Yeah. 1 minute. So what is the stimulus? Glucose. It is released in response to glucose, fatty acids, and amino acids in the small intestine. Okay. Now, what are the actions? So GIP has two main actions. Okay. First, it stimulates insulin secretion. Okay. So this is called incretin effect. Okay. What the first action is to stimulate insulin secretion, and it is called incretin effect. And the second action is to inhibit gastric acid secretion. Okay, what are the two main actions? The first one is to stimulate insulin secretion, which is called incretin effect, and the second one is to inhibit gastric acid secretion. All right. Now, what is the clinical point? So, GIP will explain why oral glucose causes a higher insulin response than IV glucose. Okay. So, GIP will explain why oral glucose will stimulate more insulin than IV glucose. Why is that? So, that is because GIP is only released when glucose passes through the gut. So, this is because it is only released when glucose passes through gut. Okay. So, this is because GIP is only released when glucose passes through the gut. Okay. Now, moving on to motilin, the next slide. Motilin. Okay. The next enzyme will be motilin. Okay. So, motilin, so we're finishing with motilin, all right. So, motilin is secreted by M cells in the small intestine. So, M for M. Okay. So, secreted by M cells in small intestine. Now, what is stimulus? Motilin is released during fasting state. It is usually released during the fasting state. Okay. And what is the action? So, it triggers migrating motor complex, MMC. Okay. So, it triggers migrating motor complex, MMC. So, this is a wave of peristalsis that sweeps undigested food and debris through the gut between the meals. So, what is it? It is a wave of peristalsis, okay, which sweeps the undigested food and debris through the gut between the meals. So I repeat it once again. MMC is a wave of peristalsis that sweeps undigested food. It sweeps undigested food and debris through the gut, okay, between the meals. Now, what is the clinical use? Erythromycin is a motilin receptor agonist. Okay, erythromycin will act as a motilin receptor agonist, and it is used in gastroparesis. Okay, so it's used to stimulate gastric motility in conditions like gastroparesis. So it is in gastroparesis, it stimulates gastric motility. Okay, so here I have a summary table. So before going on to the summary table, so I'll explain motilin once again. So what is the source? Source, M cells in small intestine. Stimulus, it is triggered during the fasting state. Now action, it triggers MMC or migrating motor complex. Okay, so that is it's a wave of peristalsis that sweeps undigested food and debris during the gut between the meals. Okay, and what is the clinical use? Erythromycin is a motilin receptor agonist, and this is used in gastroparesis. So why in gastroparesis? It can stimulate gastric motility. All right. Now I have a summary table for all the enzymes, so you can just go through it. So this all of them is simplified. The source, stimulus, actions, clinical points, and all that. Okay. So that is about the hormones. All right. Now we'll move on to the high-yield MCQs, the most asked MCQs. All right. Now, the first question. A patient has recurrent peptic ulcers and elevated gastric levels. Okay. So I repeat the question. It is a patient has recurrent peptic ulcers and elevated gastric levels. So what is the most likely diagnosis? So here a patient has recurrent peptic ulcers and elevated gastrin levels. So what is the most likely diagnosis? So the options are lipoma, Zollinger-Ellison syndrome, achalasia, and gastric adenocarcinoma. So what is the answer? The answer is Zollinger-Ellison syndrome. So what is the symptom? Recurrent peptic ulcer and elevated gastric levels. The answer is Zollinger-Ellison syndrome. Why Zollinger-Ellison syndrome? So when you have symptoms like recurrent peptic ulcers and elevated gastric levels, you'll have to think of Zollinger-Ellison syndrome. Okay, it is caused by gastrinoma, which secretes excess gastrin. So what is this by? This is caused due to, it is caused by gastrinoma. Okay, this secretes excess gastrin. Gastrinoma will secrete excess gastrin. All right, and this will lead to acid hypersecretion. Okay, so this leads to acid hypersecretion. All right, and peptic ulcers. So this is a classic clinical scenario. All right, so whenever you have recurrent ulcers plus high gastrin levels, you will have to think of Zollinger-Ellison syndrome, which is caused by gastrinoma. All right, so that is about the first MCQ. Now, moving on to the second one. Now, which hormone stimulates gallbladder contraction and pancreatic enzyme secretion? So, which hormone will stimulate gallbladder contraction and pancreatic enzyme secretion? So, we have four options: secretin, cholecystokinin, gastrin, and vasoactive intestinal peptide. So, I see the answer is cholecystokinin. Why cholecystokinin? Why cholecystokinin? So, cholecystokinin will stimulate gallbladder contraction and pancreatic enzyme secretion. Okay, CCK is the one which stimulates gallbladder contraction and pancreatic enzyme secretion. So this is its classical role in fat digestion. Okay, if you see fatty meal and gallbladder contraction, the answer is always CCK. Okay, so if you see fatty meal, these are keywords: fatty meal and gallbladder contraction. So the answer is CCK. All right. Now the next MCQ. I hope all of you are clear with the first two MCQs. Now moving on to the third one. Okay. So a pancreatic tumor causes water diarrhea, hypokalemia, and achlorhydria. Okay. So again, the question: which hormone is responsible? A pancreatic tumor is causing water diarrhea, achlorhydria. Achlorhydria. Okay. So which hormone is responsible? So that is the question. So we have four options: gastrin, secretin, VIP, and mutulin. Okay. The answer is VIP. Why? So the triad of water diarrhea, hypokalemia, and achlorhydria points to WDHA syndrome. Okay. So here this is caused by WDHA syndrome is caused by VIPOMA, lipoma. Okay, so here VIP will increase water and electrolyte secretion in the intestine. Okay, and this will lead to diarrhea. So this increases water and electrolyte secretion in the intestine. So this will lead to diarrhea. All right. So that is about that is about VIP. All right. So the triad of water diarrhea, hypokalemia, and achlorhydria will point to WDHA syndrome, and WDHA syndrome is caused by lipoma. Okay. So VIP will increase water and electrolyte secretion in the intestines, which leads to diarrhea. Okay. Now we're done. To summarize, we've covered all the major GIT hormones with their sources, stimuli, and actions. So remember the mnemonics and clinical links. So they'll help you crack NEET PG questions confidently. Okay. Thank you for your time and best of luck.